I've had anxiety for pretty much my whole life. And then I was diagnosed with PTSD about 3 years ago.
So I have obsessive compulsive disorder, and I also have some body-focused repetitive behavior.
I was diagnosed with severe generalized anxiety disorder, borderline personality disorder with depressive traits, and chronic suicidal ideation.
Anxiety is something that I've suffered from since first year of university. It was my first time experiencing actual anxiety and panic attacks.
Anxiety affects my day-to-day life by pretty much changing how I perceive the reality around me. Usually, if I have anxiety, it's just adding a tint of fear and mistrust and nervousness to situations that probably don't need to be fearful or mistrusting.
That when certain things happen, or it just randomly too, I'll be in the kitchen, for example, and start thinking about what if I picked up that knife and just stabbed my sister. And then it's instead of what a normal person would do in that situation, which is that's a stupid thought, my brain starts overreacting to it, to the point where it's okay, we gotta leave the kitchen, gotta do things that'll calm me down. I would say is that it takes up hours that I would be doing other things. And there are times when it gets really bad and I can't focus on school or focus on work, and I've had to step back sometimes to have that space for myself, I guess.
The anxiety really is a high performance thing, social situations, whether I'm doing schoolwork or, going to work at my job, whatever it is, it's very, high performance. I just kind of worry about everything at all times. It's always worrying. And then on the other hand, I have BPD, like I mentioned, and that's kind of almost in many ways the exact opposite. When I'm at home alone, it makes me very unhappy. It's very isolating. I feel very, very lonely.
I used to I have a very, very strict diet on what I eat, when I eat, how I eat. The amount of sleep that I get, it should not be more than 5 hours per night. And, socially, I don't go out with friends. I barely talk to my family, just isolation and just looking at the goal, which is to succeed in university and be an A+ student.
Someone really close to me also suffers from PTSD, and there was internalized stigma within that person that I also experienced with PTSD. And it was a lot of guilt for feeling the way that we felt. And in this particular person, it was feeling unjustified, that the trauma wasn't big enough to have PTSD. So there was this internalized stigma of I didn't have this huge thing. Am I just faking it? Do I really deserve treatment? So that was that kind of stigma that I saw in somebody else that is really relatable when you have PTSD, especially if it's not something as big as you're in the military and, you're seeing all this terrible stuff, which a lot of PTSD is, related to. When someone hears PTSD, you instantly think of military veterans sort of thing. So there's also that whole external stigma of not wanting to tell anybody because of fear of also them justifying it because it's so associated with veterans.
Back to a personal experience I had in university. So part of my body-focused repetitive behaviors is skin picking. So my hands are kind of messed up looking. And I've had it happen many times where people ask me, what's wrong with your hands? It's just not, in the middle of a tutorial, it's really not the time to explain my mental health problems to them. So I'll just say something I'll just say I have a skin condition and try to leave it at that.
I feel lucky to say that there are not many people that are coming up face to face and, telling me off or anything like that, or insulting me. So I'm lucky in that way. And I feel glad that most people are pretty understanding, or they at least try. They make an effort to understand. But that being said, BPD faces a lot of stigma, and a lot of people see individuals with BPD as manipulative and conniving and, completely uncaring, all in it for themselves, incredibly selfish. And that's really not a good look to have.
The good part that there wasn't as much stigma. I'm in university, and the majority of the people there know what anxiety is like. We know what it feels like to have anxiety. We have at least experienced it once. So when I say, "Oh, guys, like I have anxiety," they'd understand. So that was something really good. My friends were also very supportive at that time. They understood the pressure. And the fact that I was studying neuroscience has actually been one of the most helpful tools that I had, because it taught me what it meant to have anxiety. It's not a panic attack. No, this is anxiety. It's different.
With my anxiety and kind of my PTSD, my mindset the whole time was like, I don't want to feel like this anymore. And like, I don't want to live like this every day. So I basically was like, I'm going to try everything and see what sticks. Going into it, obviously way easier said than done, especially like on bad days where you're just like, okay, I'm just gonna lay in bed today and like not socialize with anyone. The thing that helped me the most was talk therapy. So in high school, I did talk therapy for my anxiety, and that really helped. I'm more of like a hands-on person. Like I love like strategies more than like getting into deep feelings. Like reading books is a big thing for me too. So like I'm a huge reader, and that's really helped me too, because then I can just like stick a sticky note on it and like go back to it and like harbor those things that really stick deep with me. Exercise was a really big one too. I think one of the biggest things to also keep in mind is to reach out to your social supports. I found that struggling with my mental health issues, I could not have done it without social support.
That this is the way it is, and that I need to work with it and not work against it, and try to deny that I have any problems and just ignore it and pretend I'm a normal person and just go into everything the same way. I need to accommodate myself, so I need to make sure like I have a therapist that I actually know. But really for me, what's pulled me through is just accepting this is the way that my brain works, and there's nothing I can do to get around that beyond trying to make it work. And part of that is learning from people with physical disabilities who have the same sort of thing, where they say like, I've been angry at my body for not working, and I get angry at my brain for not working in the way I want it to, but that anger doesn't get you anywhere. The only thing you can do is care for your body, care for your brain the way it is, and try to work with what you have, because that's all you're given. So that would be the way I would say. And also, I've found a really good community online of other people with OCD, and it's really been encouraging to see people with similar struggles say things that sound exactly like mine. But I would highly recommend you do it if you can, and find others who you can sort of joke around about how messed up you are together. That's really the best way to feel like you're actually normal and not alone.
Another thing with BPD is, unlike some other mental disorders, there is no medical intervention. There is no way to reduce your symptoms. You know, if you feel incredibly empty and unhappy and lonely, that you're gonna feel that as intense as it is. So you need to learn to cope. You know, you need to learn to deal with those symptoms, not let them overtake you, and not let them bring you down. And so not the best advice, because it's really hard to do this, but you need to have like a positive outlook. Try not to be pessimistic all the time. Try not to dwell on things. You know, everyone's going to be unhappy. Everyone's going to have a hard time. There are going to be times when, you know, it seems like everything is getting to you, and that's okay. You know, it sucks, but you'll get through it and you move on. But you just have to keep trying.
I would definitely recommend that you first recognize your triggers. What triggers you? Why does it all of a sudden, why do you have anxiety attacks? Was it something someone said? Was it a place, a noise, a situation you're in? And then learning how to calm yourself down without needing help. It's good to have people around you that care about you. It's very important, and I think it's essential actually to have a good support system. But Peaceness is going to come from within, and you have to be able to calm yourself down, to talk. If you have to talk about what's going on, talk to someone that you trust, talk to a family member, a friend, whatever. And if that approach doesn't work, then try to turn to something else. Keep working on it until you find what works for you, because I can't generalize my answer to everyone, because what works for me definitely doesn't work for everybody else. And my triggers are not similar to most people. And that's where you have to personalize the approach. It has to be very individual. As long as I put in the effort, I feel good about the effort that I put in, that gets me going.
My name's Heather Martell. I work as a student advisor at Carleton University. I basically administer the undergraduate programs in neuroscience. I support them on the various pathways to graduation. I'm also trained as a personal support worker in hospice and as an end-of-life companion.
My name is Barbara Lois Helms. I am a registered psychotherapist with the College of Registered Psychotherapists of Ontario. I'm a chaplain with the Department of National Defence and the Canadian Armed Forces. I also do a number of other community paid and unpaid jobs. I am the spiritual advisor at the Royal Ottawa Mental Health Centre. I am a chaplain with the Ottawa Muslim Association and with Cordova Spiritual Education and the Algebra Society. I'm an education director there and chair of Cornwall Interfaith Partnership.
My name is Susanna Chen. I am an MD psychiatrist in private practice in New York City, and I studied undergrad at University of Rochester. I studied in medical school at Mercer University School of Medicine, and I did my residency at Albert Einstein Montefiore in New York City. There was a lot of stigma in the past. There was a lot of this assumption that people with mental illness are an other, right? So a lot of othering and a lot of distancing. So asylums were often used just to separate people from communities. And it's really an unfair assumption and bias that was really incorporated in the past. Also, some treatments were used just to subdue people, such as lobotomies. So really quite a dark history in the past in North America.
Even before I understood what bipolar was and how it manifested in my mother, for example, I'd always been aware of reactions people had to her behavior, both in our family and in the community at large. And it wasn't until some of the pieces started to come together as I learned more about bipolar and mental health and stigma that I realized what was at play. And as I've gotten more involved with her caregiving, I've come to understand how, because of the immense shame that's involved with it, it's so common for us to keep our diagnoses and the challenges we face hidden.
There's a variety of mental health professionals, and of course, just as there's a variety of humans, there's certainly, unfortunately, the risk that some play into a part of stigma, and talking about dangerousness can often reinforce this sort of stigma and this assumption. I still do see this assumption of dangerousness really tacked on to mental illness or anything related to mental health.
30 years ago, we were asking dumb questions like, if we read a book on psychology, will it mess up our faith? Like, it was, I remember asking a sheikh that, like, is this okay, or is this gonna, do something to my brain? Because after leaving academia and going on the spiritual path, it was a different way to look at the world. And there's the idea that is somehow mental health and psychotherapy the expansion of your ego, which is the opposite of what you would do in terms of spiritual development. So those are the things that people are actually afraid, or the idea that psychology is replacing faith and spirituality. And I understand in the history of psychology and psychiatry, sometimes religion was looked at as a deficit or a shortcoming that needs to be overcome. There was also the sense that of personal deficiency, that there's something wrong with your faith. Just go pray more. If you just go pray more, read the Quran, it'll solve it. The other thing would be perhaps the idea of anti-Muslim attitudes and Islamophobia. Sometimes people would be afraid to seek help because, let's say in a case of domestic abuse, if you already feel that your community is vilified, you don't want to further show problems or deficiencies. And so sometimes people will tolerate very difficult circumstances because they don't trust the society around them to give them competent care. They want to keep that, contained. So again, Islamophobia creates conditions that intensify mental health distress, both because of the experience of discrimination and hatred, but also they'll see your Islamic lifestyle as the problem rather than the factors or even potential tools for healing.
I think Western media is problematic in all sorts of ways, and maybe most predominantly this simultaneous hypersexualization and condemnation of women's sexuality. And that's just one example. I really do think it's problematic in almost every way. There's this history of using words like overly sensitive and overreactive, and those being used as derogatory terms. And I think that's simply one way in which systems with patriarchal values attempt to silence women. Women are powerful creatures, and I think there really is an agenda to keep us oppressed along with other minorities.
If we are talking about the negative aspect, I think that the media sometimes has a tendency to reproduce broad narratives. And within those broad narratives, something done by a person of color who's Muslim, looks Muslim, might possibly be Muslim, can be presented in a way that reinforces the ideas that Muslims will be involved in violent things that are, not good citizenship. Something that has happened by a person, let's say, who identifies more sort of Caucasian Canadian will be a person with mental health issues. And so again, we are talking about mental health in both cases, but the idea that mental health / that part of Islam or your Muslim identity is part of your mental health issue that makes you dangerous. And so that adds an extra layer so that you're dealing with a stereotype in a category rather than let's unpack a specific individual situation. Now, I do see elements of change. There are times when stories start and they don't emphasize the color or the ethnicity or the religious background. And I do think that there's an effort to be more balanced. But sometimes if media reinforces what's already an exaggerated and inaccurate narrative in the collective mind, it creates more stress and distress. You know that kind of elephant in the room, that you need to identify first that you're not violent, you're not an extremist. And you almost need to put people at ease rather than the assumption that you're just fine coming in. And especially, now it's also becoming recognized, but when people say no, it's not there, we're a perfectly just society, they don't realize how many layers that one is having to go through that somebody else may not be experiencing. So when you feel like somehow that's not really real, then you internalize this and say, well, maybe there's something wrong with me. It's my problem for feeling unwelcome or feeling inadequate or feeling that somehow I don't belong.
There's this overemphasis on the violence in the world, which, there's truth in that. But because it's so focused on violence and the horrors of the world, I think we, as receivers of this media, we get a skewed view of what humanity actually is. And I found that since disengaging with mainstream media, I've noticed a huge difference in my levels of well-being.
I do think in general the internet and the utilization of internet by people has changed the landscape. For instance, people with struggles in terms of mental health are able to share their personal narratives and really from their lens and not be really changed by the media that may otherwise control the narrative. As well as mental health practitioners can also share their experiences, their knowledge, without the media really fully controlling all of the information. Other parts has been that some celebrities have shared their personal experiences, and for people who look up to those celebrities, they feel more comfortable and they can really identify themselves in them. So for them to be sharing that, it makes it really more comfortable for others to share about their own experiences and to reach out for help.
Within religion, I will help work with scholars, and it can take a situation that is just getting worse, and where a woman's going to pray and pray and pray and pray and just doesn't understand what's wrong, why she's crying all the time, doesn't want to do anything, needs a life-giving change. And so I will look for those things where I see them. One of the examples I would give, in the Prophet's last sermon, he says, be good to women, and the word is khair. And I'm not an Arabic philologist, but I will work with people that have those skills, because I'm looking for how do I find something that's healing, and sometimes to reclaim or recover the language of the Quran, as opposed to interpretations that made in the development of legal schools. This is also a process of development. This is not the same thing as the power of the language of the Quran itself, or the language that the Prophet, peace be upon him, used. So in this last sermon, there's the word khair. And so if I'm dealing with very conservative Muslims that have a very gender hierarchical thing where men's jobs really is to protect and to shield women, and there is a clear hierarchy, people could interpret this khair is to protect her from the fitna, from all the temptations of the world, so she'll stay in her home, and I'll accompany her when her goes out, and I'll make sure that there's no television. I've met people like this who, with all good intention, think that this is khair. This is not a situation I would like to be in. The actual word itself has to do with irrigation, which is raising up and distributing water. So it has, in the nuance of the word, raise up, empower, and treat as a partner. So it's part of a teamwork approach, and I see this in many different institutions. Doesn't mean that there isn't a problem, but it was really two complete separate things. You don't want to go to any professional services, and now I see this change. In the military, more in general, I want to be cautious because we're in what we call mandatory culture change. We are looking at hateful conduct, and we are really trying to understand, not just repeat the aspirational values of what everybody ought to be doing, duty with honor, but what are the experiences of people who have had systematic discrimination and hateful attitudes and obstacles, to hear them so that we can make sure on the ground we're meeting those aspirational values, which haven't changed, but how can we make sure that everybody is experiencing respect in the CAF? So there is an effort to make it better and to more authentically listen to people of color, people of different visible minorities.
Well, I think in all fairness, if some of these non-Western approaches were more formally recognized by our systems, then there would be the potential for more health insurance to cover the costs, which would ultimately allow more people to access the services. I also think that by normalizing these types of healing modalities and continuing to break down the stigma that they're invalid or bogus might garner more interest from the general public to see value in using them as part of a holistic approach. And I do acknowledge that because these professions are not as recognized in the same way by Western systems, we're still seeing a lot of financial barriers to access. So hopefully that's part of the change to come.
There is a problem sometimes when there are interpretations of your submission to law as the highest, religious law as the highest form of good mental health. Sometimes there's not enough of an awareness that some of those interpretations of religious law are culturally bound. But except for that thing that hasn't quite been worked out, this is also very exciting. And the idea that we've been doing this stuff well before there was the field of, modern psychology and psychiatry. And so to rephrase this whole thing. It's not something new that's being imposed on us by the West or any of this false dichotomy. This is something that we've been doing, that we've contributed to, and we can reclaim that.
So I think the holistic medicine view is really integrating mind, body, and soul, and really viewing it as a whole and trying to look at all the different parts. And one example could be like meditation. While the Western outlook seems to be quite rooted, at least historically, in medication and the physical body experience, and not as much in the mind and the soul part.
Scientific materialism is the belief that only physical reality is all that truly exists. So this perspective says only things that can be seen and weighed and measured are real. And Western culture is really the only culture in history to make this claim. And so it doesn't really support or encourage us to see the bigger picture or the larger patterns or the wholeness of things. So in this way, the materialistic perspective is limited and it limits us. And what comes to mind is a quote by the philosopher Jiddu Krishnamurti, who said, "It is no measure of health to be adjusted to a profoundly sick society." And so honestly, I think at the root, Western culture is simply not conducive to our mental health. And many of the approaches focus on symptom management or symptom suppression, and are not necessarily interested, nor are funded in a way to explore root causes.
I think many have started to incorporate it, especially as the research evidence for meditation has been really great. So I think they're realizing that there are a lot of good approaches and techniques that they can utilize and really integrate into their approach. However, I do believe there's probably a lot of people who are still resistant, especially if they've trained a really long time ago and during their training they weren't really exposed to different types of viewpoints and treatments. So they may feel like they're hesitant because they're not sure about this and maybe stuck in this sort of idea, well, the way I trained is how it should be, or is the best way, and maybe they're not as open to realizing that no, it may not be the best, that we're always learning and that we can learn a lot from other people and other countries and a lot of other approaches.
I think the answer lies in, bridging that gap between the Western and the non-Western modalities so as to not throw out the baby with the bathwater, right? Like, it's important to build a well-rounded, holistic healthcare team to support us physically, emotionally, mentally, and spiritually. So this is absolutely going to involve our medical doctors, perhaps our psychiatrists, and then perhaps trauma-informed psychotherapists.
It's gotten much better. I mean, there's still pockets of lack of culturally competent care. So not every institution has done well with Muslims, but it's not across the board. And I see that in mainstream institutions. I also see this within the Muslim community. And so what happens is to install somebody in a masjid setting, or that's available through the masjid, who's wearing a hijab, who's called Sister So-and-so, they're trying to bring the services to the community rather than expecting the community to go out to the services. So that's just one example with the Ottawa Muslim Association. So I can be there as a consult, and this is something a psychiatrist, social worker, various people will say, hey, I'm dealing with a Muslim client, and can you help me understand what are the factors there? And so that I might add some insight, so then the professional who is dispensing the therapy treatment will have a clear understanding of the patient's needs. I also see something that is changes in the profession itself. So for example, I mentioned going to a training in the Royal Ottawa. They had something on the integration of spirituality and psychotherapy. These are not seen as two conflicting fields. It's recognizing the importance of spirituality in promoting good mental health, recognizing when religion is a phobia and a harm versus when it's a factor that produces health. Within the Muslim community itself, I mean the academic or the scholarly community, we've developed two different very interesting models for mental health. One of them is culturally infused counseling, like counseling Muslims. And that is when you take mainstream modalities, Rogerian counseling, CBT, emotionally focused therapy, all of those things, you take those frameworks and you learn how to apply it to Muslim clients.
I think it's very important for mental health professionals to be very cognizant of the different racial issues in the world. So there can be a lot of chronic trauma that can occur in people if they've experienced racial trauma over the years. And it can be really hard for people coming into treatment to explain that to therapists, especially if the therapist is not very open or aware of these. Quite often, it can feel very dismissive if the therapist assumes that's not what's going on. For instance, if someone, talks about not getting a promotion simply because of their race, gender, or something else, if the therapist then dismisses that can be such a horrific experience for that person and really make therapy something that they might never want to try again. So therapists really have a responsibility to be cognizant of all these things and mostly have cultural humility, which is that they might not be able to know every single thing about every single person and every single community. However, when they're open to learning and not making assumptions, then they're able to create that safe space. The other thing is being cognizant about the dynamic in the room, including if the therapist might look like the population that is oppressing the person who is in front of them, and to make sure that they are not reenacting any trauma. One of the best things, I think, to try to utilize in order to make sure that your biases are not coming into the room is seeking supervision. I've been able to have diverse supervisors, and that has been one of the best things for my education. And I really recommend that for any mental health professional, either they continuously, have supervision, or that they seek diverse supervision from someone of a different background in order to help their patients.
Well, I think that the foundational features, it has to be a good fit. So having a therapeutic alliance so that there is a sense of trust and empathy. And part of that is that the professional has to recognize that the client is the expert in their own life story. Like the professional will help reflect back dysfunctional patterns and things like that. But whether the professional is religious or not religious, they can't say, I don't like your religion. They can help the client identify ways in which religious beliefs may be manifesting in dysfunctional ways. But it is up to the professional to speak the language of the client, and also to be aware of and free themselves of unconscious bias that was like, well, the religion itself is the problem. Find functional models, right? And get away from those stereotypes and say, well, in this case, this manifestation of religion is problematic, and speak to people and find out what are the ways in which religion can be life-giving and very functional. Recognize that the client is the expert in their own story. You are just giving them the tools to help them get out of a dysfunctional place to what they want to happen. And the therapist has to not be imposing their view. They have to be really honoring the client's central role in their own healing. When I was in St. Lawrence, I just assumed that the first thing somebody wanted to know was about my hijab, and I had to sort of show them that I was like not fundamental or like that's the conversation you think you need to have because you're starting out assuming people don't trust you. And my supervisor said, hey, listen, Barbara, you could be wearing a banana on your head. They could care less. They just want an appointment. And she was right. The only time anyone said something to me, somebody said, hey, are you Amish? And I was like, no. So that was my problem, not that clientele. And the same thing is happening now, I think, I assumed that, if I'm dealing with someone who's taken a tour in Afghanistan, they're not going to be okay with me. But there's sometimes military members that have been to Muslim countries. They have bigger triggering with uniforms. They may have felt institutional betrayal. So if I do want to pause. If there is someone that finds the hijab distressing in a clinical setting, I will want to value the client experience. That has not happened yet. The other thing is that there's an interesting area that people who are coping with moral injury and PTSD that's combat related may actually find it adaptive to sit down and have a conversation with me and to distinguish between enemy Muslim in that context and Canadian community, neighbor, colleague.
We can create a much better treatment when we integrate all the different viewpoints together.
I do believe that committing to a regular practice in the name of healing ourselves and the collective can certainly be a powerful catalyst for change. And I think that it's a combination of inner work and work in the external world. I recognize that this is not easy and it's not a quick fix. This more holistic approach involves a lot of ongoing work, but there's huge value, huge value in getting to know yourself beyond body and personality.
Don't think of your life in terms of what you can't do. This is not to put a happy story on discrimination and sacrifice, but be aware that what is your handicap right now might be your strength. There'll be a time and place where this is your voice.